Hello and welcome to the Stem Cell Healing Institute podcast. In case you have any questions, please send us an email to info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. We are here with Dr. Zahra Figueredo. How are you, doctor?
Very well, Louise. Thank you so much. How are you doing today on this sunny Wednesday afternoon?
I'm doing great as always.
That's great.
So, doctor, we do have a very interesting topic today because this is like an unusual topic. I believe we never talked about this one before, and a lot of people have been asking for you to do this podcast. So, we're gonna talk about stem cells for gums and teeth. Is that correct, doctor?
That's right. That's right.
So in this case, can you give us your perspective or a general picture of stem cells in the dental context?
Yes. So in dentistry, stem cells and the teeth and gums respond really well to stem cells and growth factors. There are some dentists out there that are doing a lot of PRP with gums and teeth, but we go to the next level and we use the growth factors. We use mesenchymal stem cells as well as exosomes in regenerating the various parts of the dental work. So it's very responsive in dentistry. In terms of how the mouth and the gums, the ligaments, the dentin, the pulp, and the teeth itself, how they respond to the stem cells. Very well.
Can you tell us what PRP is? Are or is?
Yes, the PRP is a crude version of platelet lysate. PRP is platelet-rich plasma, and it's platelets that are injected into the body that break open inside the body in order to release the growth factors. Platelet lysate and growth factors, purified growth factors, are basically purified growth factors and not the platelets that are injected. So it's a much more advanced procedure, much more concentrated, less numbers of sessions. Sometimes, in different procedures, we may only use autologous growth factors and not necessarily need stem cells. So we will always use the platelet lysate as opposed to platelet-rich plasma.
Thank you, doctor. Why is it so important to keep our gums healthy?
The gums are the anchors for our teeth. So it's really important that we keep those gums healthy so that they can anchor our teeth and so that the teeth have somewhere to reside. And usually it's in cosmetic procedures, bridges, implants, and so on and so forth that we need to ensure that the gums are healthy and that the ligaments in the gums are healthy in order to hold and anchor those, either the prosthetics or the actual tooth itself. And also the gum is very protective. It keeps food away from the nerve roots, from the tooth roots, from the rest of the teeth that we can't necessarily access with brushing and flossing. So the gums are very protective.
So in this case, can we say that the stem cells can help to regenerate gums and even teeth?
Yes. So our goal is to regenerate damaged teeth, decayed teeth, regenerate the dentin, which is below the enamel, the dentin and the enamel to some degree. The pulp, which is where all the nerves and the blood vessels and everything reside that help the growth and nourishment of the teeth itself. And so yes, so teeth, so actual bone cells are regenerated, actual gum cells are regenerated, and then we pay particular attention to the dentin and the pulp regeneration, as well as the ligaments that hold the teeth in place, which are also regenerated by the stem cells.
So, doctor, how come we don't hear anything about stem cells as far as gum and teeth treatment?
It's more there isn't a lot of it being done, and whatever is being done are by the savvy dentists and periodontists that know about PRP or platelet lysate. So not a lot of stem cells and regenerative medicine is being done in the dental industry. However, it is becoming more and more known, and we work together to especially for cosmetic procedures, like I mentioned, where we require a good solid foundation for prosthetics, for implants, for bridges to take hold. That's mostly what we work with.
How long does it last, this treatment? I mean, if I get the treatment today, how long would it last on my gums?
Ah, that's a important question to note because it's not the obviously the regeneration is not overnight. So once the stem cells are deployed directly into the gums and the teeth area and the ligaments and the pulp, it takes a good. We always our general rule of thumb is a good 3 months to allow for that regeneration and the building up of the tissues to take place before further procedures can take place.
In this case, does it require more than one treatment to keep my gums healthy, or would it be enough just one treatment?
In most cases, one treatment is enough. If there are enough stem cells as well as exosomes and growth factors injected, and what we do is again we're so comprehensive that in that comprehensive nature and approach, we tend to. I like to say we kill a bunch of birds. And so we will also do an IV of stem cells so that we get the stem cells to everywhere the blood flows. And that means also through the blood directly to the pulp, to the gums, and the rest of course, the teeth don't have much of a blood supply, but the pulp does. So we'll do an IV of the stem cells. We'll do local injection of the stem cells into the gums, ligaments, pulp, teeth, damaged teeth itself, and whatever else we feel necessary. If we need to build up some of the jaw area, we will do that as well with stem cells.
Doctor, when we talk about a treatment for gums and teeth, are those two different treatments, or is it just one treatment for both? I mean, can you do a combo?
Thank you, Louise. It would be together. It's sort of we can't do one without the other. That would be quite neglectful. So we would do everything at the same time, which is really important, and that's why the numbers of the stem cells are so important. And we use unprecedented numbers. We use a really high amount of exosomes, which are growth factors from stem cells themselves, as well as autologous growth factors from platelets in your own body. So yes, we and our cocktail comprises other components as well that are very healing and just build off of each other.
So, what would be the expectation for a patient after doing this treatment?
We can expect after a few months, we can expect a good foundation of a stronger ligament in the teeth. We can expect a buildup of the pulp. Okay, we can expect stronger teeth and dentin as well, and the gums themselves. We can expect a stronger foundation with the gums holding everything else into place. And sometimes we have to wait longer. Sometimes we may need another treatment in order to have enough regeneration to do uh, a greater cosmetic procedure. So it's very individually based, and we address it on a case by case basis.
Doctor, do you do this treatment by yourself or do you have the assistance of a dentist?
Absolutely. I am not a dentist. I'm not a periodontist. So we absolutely we have our team of specialists in each respective field. So in this case, we would work with our highly renowned dentists as well as periodontists in order to apply the stem cells in the most precise manner possible. So we work together as a team.
So, doctor, in this case, for these dental applications, stem cells for dental applications, do you do the whole comprehensive approach with this type of condition?
Yes, yes. Again, it's very important that we do begin with detoxification. We have to remember that our teeth is a big portal for bacteria, viruses, all kinds of microbes, and that's why with faulty dental uh, hygiene, we can accumulate a lot of bacteria, microbes, a lot of toxins from our mouth. So the detoxification is really, really important. That our total detox program, and as well as the growth hormone therapy, which again prepares our body to receive the stem cells and for the stem cells themselves, because we would most likely use bone marrow stem cells, bone marrow derived, and or a combination of other stem cells, as well as the oxygen therapy, which is so important in regenerating those cells of the mouth as well, and the stem cell enhancement formula, which again is really important for the whole picture. And again, just preparing the body for the stem cell IV, the local injections, and just creating the best environment for the stem cells to take hold and to do their best possible work.
And doctor, before your patient comes to Guatemala to do these treatments, do you have some basic tests that you require before they arrive?
Yes, we
In this
do.
case, for dental, what would you be asking?
Yes, we would want to see x-rays. We would want to see blood work. So x-rays of the mouth area, definitely. We would want to see blood work, and we would want to see any special procedures that have taken place or in any reports from dentists or periodontists that have anything to report. And then a medical intake form that we take for all of our patients in order to get a good background of general health and well-being.
How long does this treatment take?
We have our patient here from 7 to 10 days in order to accomplish everything we need to for the pre and post treatment, and then we wait and see how well the patient proceeds.
All right, doctor. As always, I ask you, is there anything else you would like to say in this podcast?
I think you do a great job finishing up the rest with all of the contact information at the end of the podcast.
Yes. So, in case you want to contact Dr. Figueredo, by the end of this podcast, you will find all the information how to reach her. Thank you, doctor, and I wish you a great afternoon.
Thank you, Louise. You as well.
Bye bye. Thank you for listening. In case you have any questions, please visit our website, stemcellhealinginstitute.com. Or you may send us an email to info@stemcellhealinginstitute.com. If you want to contact us from North America, you may dial +1 209 690 7836. If you want to send us a message through WhatsApp, please add us at +502 4220 7297. And this is how you find us on our social media. On Facebook, Stem Cell Healing Institute. On Instagram, Stem Cell HI. On Spotify, Stem Cell Healing Institute. On YouTube, Stem Cell Healing Institute. We hope to hear from you. Thank you.